Well, we have been receiving a lot of questions related to COVID-19 as things constantly change, both globally and right here in New Hampshire.
So we asked you to send in your questions for Governor Chris Sununu. He is joining us live on set. But before we get to him, we are practicing social distancing here at WMUR.
That's right. So you may have noticed that our shows have been looking a little different as we're making sure that we're standing at least 6 feet apart from one another, and a very limited number of guests also in studio. So today, I will start with the first questions for the governor. And good evening. Thank you so much for joining us.
Thank you. I love coming.
Yeah, we all appreciate these. The first question is, are tests still in low supply? Are there expectations that tests will be made more widely available before reopening schools, businesses, and other non-essential functions in the state?
So I wouldn't say that tests are in low supply, but we could always use more tests. I mean, ideally, I'd love to test everybody across the state almost immediately and be able to quarantine. So when healthcare providers determine that the symptoms require a test, tests are there and they are available for folks. We run anywhere between 400 and 600 tests on any given day in the state of New Hampshire. We have some new devices that have come in. I express a little bit of frustration because only a couple of them will be able to get online until we get the materials and supplies from the federal government, these new rapid fire Abbott COVID tests that can come in. So hopefully those will be up and running soon, but until then we're kind of waiting for the federal government to provide those supplies. But right now we're not in low supply. Again, technically we will never have enough, right? You can never kind of test people enough, but right now we're maintaining our own.
Well, Marcel is asking, can you, Governor, not just find and buy the testing kits that we need? They're made in Maine, if he's not mistaken.
Yeah, a lot of the test kits are made in Maine, and for a while, essentially, we were competing with the federal government. So they had, for a while, that they can only sell the Abbott rapid test. They can only sell their equipment to FEMA. And ultimately the FDA and through FEMA. So we are limited. We can still only get our stuff through FEMA. I would love to drive over to Maine. I would drive there myself right now if I actually could, but they're contracted to only go through FEMA. And that way the most high impact hotspots of New York, Chicago, Boston, New Jersey, they're going to be given priority. And I completely understand why, but we need more of those supplies. It's very frustrating to be given the device and not be given the actual supplies to run them. Hopefully we'll get there in the next day or next days or a couple of weeks. We just don't know. They haven't been very clear about the date yet.
Definitely a very fluid situation there. Laura Lay is asking, why are the actual infected numbers of each town not given to the public? Why do we need to guess between 10 or 19, for example?
So in other words, so we do a town-by-town map, but usually we give a range. I think that's so we can color code it appropriately. So yeah, we give a range between 10 and 19. I guess we could go to a more exact number, but I could talk to the folks at Public Health about it. It was a huge step just to get to the point where we're giving a range. Partly because for smaller towns, if you only have one or two, you can kind of discern who might have it, right? If there's only one or two people in a small town, and that's a very bad thing. You don't want to be able to indirectly disclose who might have it. So I think we're always going to keep it in a range just to keep people guessing a little bit, but give folks in those towns a sense of what the impact is.
Meanwhile, Heidi asks, I would really like to know when the decision about school for the remainder of the year will be made.
As a dad, I'd love to make that decision right now, just as a dad with 3 kids in school. Right now, our date is set to May 4th. We're going to make it before then, I promise that. Given that the situation is so fluid, I mean, we've already seen some certain numbers come down. We've seen the death rate, unfortunately, go up. We've had 5 deaths just in the past couple of days. So we're always reevaluating our model. Data trumps the models, and data really repredicts the model almost on an hourly basis. So my hope is to make that decision a week or 10 days before the May 4th deadline, and that way give parents and educators alike the time to plan.
All right, Governor, thank you so much. Stay put.
You bet.
We appreciate your time.
I feel like I'm on Granite State Challenge. Just keep firing it.
We got more firing for you. Stay tuned. We've got more coming up with the Governor after the break.